Hello everyone, my name is Varda Sheikh and the topic of my presentation is from the chapter Acute Drug Toxicity, which is opioids. So what are opioids? They are psychoactive chemicals that trigger our brain receptors and nervous system. It also binds with the receptor of gastrointestinal tract. Let's come to the types of opioids. There are three main types of opioids. Number one is natural opioids, which comes from opium poppy, which includes morphine, codeine, and thebaine. The second one is semi-synthetic one, which are made from natural opioids. They include heroin and morphine. The third one is fully man-made or fully synthetic one, which are completely made by man in the labs. They include methadone, tramadol, levofenol, etc. Let's come to the slide opioids abuse and addiction. The non-medical use of opioid pain reliever are considered as its abuse. According to a survey, heroin, cocaine, and all are being used illegally in teens and adults. The person using opioids have certain diagnosed side effects and withdrawal syndromes. Opioids with shorter duration have intense abstinence syndromes, whereas opioids with the prolonged action have milder withdrawal symptoms. Let's study a case of such a patient. A person of age 21 was unconscious after alleged dose of heroin. He had decreased respiratory rate of 4 breaths per minute, cyanosis, symmetrically pinned pupils, and slightly decreased blood pressure. He has one fresh track and several old tracks of needle. In the antecubital fossa, what is the immediate treatment of choice for the patient? The subjective for this patient is that his age is 21 years and the problem is overdose of heroin. We can see the objectives and the chief complaints are cyanosis. Cyanosis refers to the blue cast of skin and mucous membrane caused by low level of oxygen in the body. The second thing is shortness of breath, and the third thing is decreased blood pressure. Showing that assessment shows that a person have recently been subjected to heavy dose and he's habitual of taking heavy dose of opioids by IV route, as fresh tracks and old tracks have been seen in the incubital fossa area. Also, the cyanosis shows that the patient is allergic to low level of oxygen. Now the plan. The plan is to give him the immediate treatment of airway management, to prevent and relieve airway obstruction. Naloxone, an opioid competitive antagonist, is given through IV route. The dose would be zero point 0.2 to 0.4 mg drug, and repetitive doses are given if the patient is unresponsive. Also, the dose could be increased to 10. Also, the dose could be increased to 10 mg. As methadone is a long-acting opioid, hence serial dosing is given every 20 to 60 minutes. Also, a patient should be careful to naloxone therapy to prevent reappearance of opioid toxication. This is how a patient subjected to opioid toxication is handled. Thank you for your time and attention.